Coughing, sneezing, chills, stomach aches. It seems like a lot of people are sick right now. And emergency rooms are filled with people who have the flu, COVID, RSV, and norovirus. Doctors are calling it a quademic. Joe McCoy checked in with doctors today.
You've heard about a pandemic.
Our volumes are up 30% plus over a comparable flu season.
But what about a quademic?
We're trying to be creative, trying to see patients in hallways, trying to see patients in alternative care areas.
Emergency rooms in Minnesota and across the country are filled to the brim as flu, COVID, RSV, and norovirus cases skyrocket. This leaving emergency room physicians like Dr. Brandon Trigger at M Health Fairview Southdale trying to stay afloat. How has this large uptick in patients in the emergency room been for you personally trying to deal with this?
We're really spread thin, and oftentimes, weeding through the masses of folks to try and get to the patients that really need emergency care the most.
According to Minnesota Department of Health Influenza Surveillance Supervisor Melissa McMahon, from December 28th to January 4th, Minnesota saw 722 flu hospitalizations, the most ever in a week span since the department started tracking this data in 2008.
We're hoping this is as high as it gets and then it starts to fade pretty quickly in the next couple of weeks, but it's impossible to say right now.
McMahon recommends washing your hands regularly, staying home if you're sick, and wearing a mask in crowded spaces. She also says flu shot rates are way down this year, which could be fueling the spike.
We're just under 30% for vaccination rates for people in Minnesota of all ages. Prior to the pandemic, we usually saw like 50 to 60% vaccination rates.
Hospitals are urging patients to only visit the emergency room if absolutely necessary. There were 270 deaths in Minnesota from the flu in 2024. That is the most in a 5-year span.